Hello, and welcome to Integrative Therapeutics. My name's Todd Foreman. I'm a physical therapist, and I'm the owner of Integrative Therapeutics here in Natick, Massachusetts. And I want to talk to you a little bit about lower back pain. Specifically, physical therapy is how it relates to lower back pain. Now, lower back pain is a nearly universal phenomenon in this country. Over 80% of adults will have at least one incident of debilitating lower back pain at least once in their lifetime. It's a nearly universal problem. The issue with lower back pain, though, is that while the symptom is universal, the cause is often very individual. And this is why, despite almost everyone being plagued by lower back pain, no one has come up with a really good way to treat it. This is sort of the musculoskeletal equivalent of the common cold. Everyone has it, everyone suffers from it, but there's really no one thing, no one intervention that will cure it in all of the people. Well, all the people that have it. Well, why is that? Well, the issue is really because lower back pain is very often mechanical pain. And mechanical pain is very different from pain from an injury or pain from inflammation. Let me see if I can give you a simple explanation. If I take my finger and I pull it back like this, I'll feel a little stretch in my palm. And if I let it go, nothing comes of it. In a few seconds, the symptom goes away entirely. If I take my finger and I pull it back like that and I hold it there for an hour, this part of my palm and front part of my finger is going to get really uncomfortable. It's going to hurt. Now, I can x-ray, I can MRI, I can CAT scan, I can biopsy this tissue into my finger immediately when it's so painful, and every single one of those diagnostic tests is going to come back normal. Just like with many people with lower back pain, they've gone to see a physician and then an orthopedist, and then they've had x-rays, and they've had CAT scans, they've had MRIs, and most of these things are normal. And the docs tell them, well, you're fine. Well, you're fine, but it still hurts. But very often what happens in the lumbar spine is a combination of what I'll describe as a dysfunction or an aberration in normal motion that results in increased mechanical stress, and that in turn causes lower back pain. So we've got a mechanical cause for the pain. How does that happen? Well, look at the lumbar spine here. Number of bony blocks stacked one on top of the other. Each bony block there is supposed to move. It's supposed to forward and backward bend, side bend to either side, and twist to either side on its partner, on the one that it sits on. This motion is controlled by a pair of joints. There's a right and a left, and it's also controlled by a large group of musculature. Some of that musculature, turn this guy around so I can give you a better view. Some of that musculature is quite small. We see the intertransversi represented on this model here. This small musculature controls how one bone relates to another. The next more superficial layer of that musculature controls how one group of bones will move on another group of bones. But the important thing to remember here is every segment of the spine, from the skull down to the sacrum, has got a role to play when we do normal motion, whether we twist to get a juice bottle off of the counter or whether we twist to do a golf swing. Everything from the neck on down has a role to play. Now, the mechanics of that means that if we have a stiff segment, that segment can't move through its normal range of motion. And what happens is that while we function, if a given segment can't do its job, the other segments have to make up for that. They have to go through a greater excursion or bear a greater percentage than normal of the mechanical load we're placing on it. And very often it's that area that's asked to compensate for a dysfunction that gives us a lot of lower back pain. The other thing that we start to see is that a lot of the hip musculature is attached to the pelvis and the lumbar spine. And in the physical therapy clinic, we almost universally see that people suffering from lower back pain have what's called a lower extremity muscle imbalance, essentially an imbalance in either flexibility or strength, usually both, around the hip and thigh musculature. Either one hamstring, the muscle that runs down the back of your thigh, is too tight. Perhaps, and this is often a very big player in lower back pain, the psoas muscle. It runs at the front of the lumbar spine. See it from the front underneath all the viscera. It's represented here on the model. This muscle is very, very commonly asymmetrically tight in people who suffer from chronic lower back pain. This is a hip flexor muscle. It's very tight in people who sit for a living. And this is a very big player in lumbar spine pain. In general, our job as physical therapists is to determine exactly which one of these combinations of causes, tight hip flexor, stiff segment in the thoracic spine, stiff segment in the lumbar spine, a weakness in the abdominal muscles, weakness in the gluteal muscles, weakness in the hamstring muscles, or any combination of these, our job as physical therapists is to evaluate what an individual person has, which combination of these dysfunctions an individual person has coming into us, and then plot a logical course to address these issues and ultimately bring the problem to resolution. Now, good physical therapists make themselves obsolete because when we address all of these issues and we teach you the proper exercise program to maintain both normal mobility, strength, and flexibility, the mechanical cause for the problem goes away. The back pain goes away, but most importantly, you've got a tool to keep the back pain at bay. You've got a tool to not only just manage the symptom, but cure the cause so that you can go out and function and do the things that you want to do without ever having to darken the office of a physical therapist again. Thanks.